Thank you for tuning in to the Brach Eichler Talks podcast, where we explore and discuss today's trending legal topics. In this episode, we'll discuss a recent healthcare law alert from Brach Eichler titled COVID-19 State of Emergency Ends. APNs and other healthcare providers impacted. On January 16, 2026, Governor Phil Murphy signed Executive Order Number 415, formally terminating several long-standing states of emergency in New Jersey, including the COVID-19 state of emergency, which was originally declared in Executive Order Number 103 in March 2020. Effective as of February 16, 2026 at 5 p.m., the flexibilities that certain healthcare providers were granted in 2020, such as the ability of advanced practice nurses, APNs, to practice independently without joint protocols with a collaborating physician, will be rescinded. Healthcare providers and facilities should ensure full compliance with scope of practice, supervision, and collaborative practice requirements that were previously not enforced during the state of emergency. In particular, providers and facilities should be aware of the following. 1. The temporary waiver that permitted APNs to prescribe or order medications and devices without a joint protocol with a collaborating physician will expire. APNs must return to full compliance with the statutory requirements for practice, including maintaining a joint protocol with a collaborating physician for prescriptive authority. 2. The temporary waiver that permitted physician assistants, PAs, to practice without a delegation agreement and physician supervision will expire. PAs must return to full compliance with the statutory requirements for practice, including maintaining a delegation agreement with a supervising physician. 3. Providers practicing in New Jersey under a temporary or foreign license will need to transition to a full New Jersey license in order to continue practicing. Coinciding with the executive order, Senate Bill 2996 was introduced in the New Jersey Senate on January 13, 2026, to expand the scope of practice for APNs. If passed, the bill would represent a major shift in healthcare regulation, allowing certain experienced APNs to practice independently of a collaborating physician. In particular, the bill would permit APNs who have completed 24 months or 2,400 hours of licensed, active, advanced nursing practice to practice without a joint protocol with a collaborating physician. In addition, APNs anesthesia who have completed 24 months or 2,400 hours of licensed, active, advanced nursing practice would be authorized to practice without any requirement for supervision by a physician and without any requirement that the APN anesthesia enter into joint protocols with a physician. If you have questions or require additional information, please contact John D. Fanberg, Esquire, Managing Member and Chair, Healthcare Law at jfanberg@bracheichler.com or 973-403-3107, or Edward Hiltonrath, Esquire Member, Healthcare Law at ehiltonrath@bracheichler.com or 973-403-3114, or Rebecca T. Falk, Esquire Associate, Healthcare Law at rfalk@bracheichler.com or 973-364-8393. Don't forget to subscribe to our podcast on Spotify, Apple Podcasts, and YouTube. Follow us on LinkedIn and Facebook for updates on new episodes. For more information and resources, visit bracheichler.com. This is intended to provide general information, not legal advice. Please contact the authors if you need specific legal advice. Brach Eichler LLC is a full-service law firm based in Roseland, New Jersey, with over 80 attorneys. The firm is focused on the following practice areas: healthcare law, real estate, litigation, trusts and estates, business transactions and financial services, personal injury, criminal defense and government investigations, labor and employment, environmental and land use, family law services, patent, intellectual property, and information technology, real estate tax appeals, tax and cannabis law.